Welcome, everybody. I'm Jocelyn Mementa.
And I'm Vicki Veltri, your healthcare advocate.
Let's talk about what OHA can do for folks.
Sure.
What's the mission?
OHA really has a three-part mission. The first is to really educate people about their rights under their health plans, help them pick a plan. That includes private plans, like private insurance, or public plans, like Medicaid, Medicare, TRICARE. The second part of our mission is to help people when they have problems with their plans. So we do a lot of work helping people with grievances and appeals when they've been denied something. Yeah, we advocate for them with their carriers. And the last part of our mission is to do systemic healthcare advocacy. So when we see a problem that keeps repeating itself, we go to the legislature, we go to the federal government, the administration, and try to fix it.
Well, you've helped thousands of people through the years. What are some of the new rights under the Affordable Care Act?
So probably the biggest things that I think of when I think about the rights in the Affordable Care Act is the ability to get preventive care at no cost. Used to be, even when you went for a physical or a screening that you needed, you'd have to pay that co-payment or that out of pocket. But the Affordable Care Act eliminates that, and it eliminates those because we want people to go get those screenings. Because when you get your screenings and you get your preventive care, you tend to have less need for catastrophic treatment.
Also, health plans can't refuse to cover children because they have a health problem or disability?
That's correct. That came right out of the gate with the Affordable Care Act, that children could not be denied a policy any longer because of disability. And believe it or not, we were getting a lot of those cases where kids with serious medical conditions were not able to get an insurance policy.
Also, plans can't charge you more or refuse to cover you because you have a health problem or if you're pregnant.
Right. So some really good things that happened with the Affordable Care Act is we changed the way insurance companies can do what's called underwriting. And so it used to be, or it is still now until 2014, the insurance company can say, look, if you have a health condition like such and such, a heart condition, I can charge you more because I think you're riskier. Whereas this person who's never had anything, I'm going to give them a break. In 2014, that goes away. So they can't differentiate.
It really levels the playing field.
It does, and that was important because a lot of people who had health conditions were getting priced out of the marketplace because of those very conditions. So it was a disincentive to buy insurance coverage. The other thing is that I think is a really good thing is that they also changed the ability of an insurance company to charge a lot more depending on your age. So right now, if you're 50 or so, you might be paying 6 to 7 times more than somebody who's 25 for the same policy. But in 2014, the maximum that an insurance company can charge is a 3-to-1 difference, so 3 times as much for a 50-year-old.
Also, young adults who cannot get insurance through their employer can stay on their parents' or guardian's plan until the age 26?
Yeah, that has been probably the most successful provision. In fact, probably the most touted provision, I think, of the Affordable Care Act. And that was another one that just came right out of the gate. So people were able to take advantage of that right away. So unlike some of the other provisions of the Affordable Care Act, which don't kick in until next year, this one has existed. So people have seen the benefits of it. It is huge.
And also that these plans cannot cancel your coverage if you've, just because you got sick or made some kind of mistake in your application.
Yeah. So that is actually a very big piece. It's kind of nuanced, but what used to happen is, and what we would see in our office, in fact, we had to pass a state law in advance of the Affordable Care Act to try to protect people, is you might have filled out your insurance application, and most people do have to fill out an application when they buy by themselves an individual policy. And you may have made a mistake or not known that you might have had an illness. Then you might have gone to the doctor a few months later, been diagnosed with something, and the insurance company would go back and try to investigate your application to see whether you should have known that you might have had that illness in a couple months. And if they thought you should have known it, they would pull that policy away from you, and you'd be facing lots and lots of medical bills. So that totally
eliminates
that. So they eliminated it. They would have to prove that you really committed fraud or something. And most people are honest when they fill out their applications. So.
Well, let's talk about the new ways to get health insurance because of the Affordable Care Act.
So lots of new ways to get insurance. So the Affordable Care Act doesn't change the existing marketplace. And that was the chief tenet, one of the chief tenets about the Affordable Care Act. If you liked your policy, you could stay on it. That's very true. You can stay on your policy. If you're an employer and you already offer insurance to people, chances are nothing is going to change for those employees. it's really the small businesses and the individuals that are going to get the right to access some new opportunities. And in fact, there will be the right to buy again in the existing individual market or small business market, but then we have the marketplace. And the whole idea here was to have one place where everybody could go to do one-stop shopping that would take away some of those administrative hassles that people have to go through when they're buying insurance. And so they can come to this marketplace that we're calling Access Health CT, and they can buy an insurance plan from one of 5 companies. At least right now we think there are 5 companies, highly reputable companies, that will be offering policies, and people will get discounts.
Fairly easy, just follow the instructions and fill in the information.
That's
and
right.
It'll basically tell you, right?
Right, we have what's called a portal. There is one application, it's called a streamlined application, that is one application for whether you're applying for Medicaid or a regular insurance plan. It will be able to, as you're putting in your information, it will tell you what you qualify for. So it's a very easy process.
Again, people can get financial help with
That's
their
right.
insurance if they can't afford it.
That's right. So if your income is below 133% of the federal poverty level in 2014, which is about $1,200, $1,300 a month, you'll be able to get on Medicaid. If you're above that limit, and up to about $44,000 or so for a single person,
$44,000,
and about $92,000 for a family of 4, you'll get federal financial help. And how it will get to you is you won't even see it. It'll be, instead of your premium, let's say, being $500 a month, it might be $200. You'll just get the bill for the $200. You won't have to worry about paying the extra premium.
And there's going to be a lot of help out there for folks.
There's going to be a ton of help. Look, the marketing.
You call it the Sisters Program Centers?
Yes. So there's about 4 different ways people can get help. So one is to go on the Access Health CT portal where people can apply directly. Another is through a broker. Anybody who uses a broker could still use a broker. Brokers have to be trained and certified to sell the plans that are in the exchange, but they can help people. And the other chief way we think a lot of people are going to get their help is through navigators and assisters. And there are over 300 assisters. There's going to be 700 people at least trained, another 1,000 people trained that work at the Department of Social Services, and 6 giant navigator organizations around the state that will help people on the ground enroll. In addition, Access Health CT is going to have some retail stores around the state where people can just walk in and get help and enroll.
So plenty of ways to get the help you need.
Plenty of help will be available.
This will be a complex situation for many folks, especially
Right.
who've never had insurance before.
Right, and there will be situations, let's say, where a broker is helping somebody and then they end up referring them to one of the assisters for more one-to-one, and vice versa. So we have set up this system so that anyone almost anywhere can get access. And there will be a call center available too every single day to help people.
Okay, what if somebody has a problem with their current health care plan?
So
They need to call you, right?
That's what they come to us for, right? So OHA is not only just partnering on the Navigator Sister program, but we're here to help people with their existing insurance issues. That's what we do every day. So if somebody needs to reach us, they can call us at any time. We have a toll-free number, and it's 1-866-466-4446, and they can call us anytime. We have 24/7 coverage. They can also visit us online at www.ct.gov/OHA. We speak both Spanish and English, and we can educate people on their health care rights, help them with a problem with their insurance. We are advocates, and that's what we do. We're here to advocate for you.
Just really quickly, what's your success rate generally when you're helping folks fight their health insurance plan?
So our success rate is really around 85% on our appeals.
Very good.
Yeah, 85% we overturn. Behavioral health is slightly less, around 70 or so percentage, but we overturn a substantial number of denials.
That's amazing.
We find sometimes it's just so complicated that people really need that one-to-one help that an advocate can provide.
Again, that number for people?
The number again, 1-866-466-4446.
All right. Thank you for watching.
Thank you.